Afternoon, everybody. Welcome to this. Oh,
It's all right. You crack it on.
apologies, slight tech issue, but it's all been dealt with. Welcome to today's Health Select Committee on the afternoon of the 12th of March 2025. Good to see you all, and good to see the sun shining at last. I'll launch into item number 1 straight away. Apologies and substitutions. Ben, I believe we've had apologies from Councillors Horace Prickett, Tony Pickernell, Councillor Monica Devendran, and Horace is there. I will defer to Ben on apologies.
No worries. So I can confirm that we have apologies from Councillor Tony Pickernell, Councillor Monica Devendran and Councillor Howard Greenman. We've also got apologies from Cabinet members, Councillor Jane Davies, Councillor Ian Blair-Pilling and Councillor Richard Clure. Thank you.
Great, thanks Ben. Apologies for the confusion there. Horace, and good to see you. Minutes of the previous meeting, item number 2. Is the committee happy for me to approve the minutes of the meeting held on the 22nd of January 2025? Just for context, at that meeting, the committee resolved to receive a briefing from the Integrated Care Board on the new community health contract, following questions raised by the public at the meeting on the 22nd of January, which I'm sure you'll all recall. We did have that briefing on the 14th of February. Thank you to those of you who attended. The report prepared for that briefing and the written response to the public questions raised at committee in January are attached to the minutes of the January meeting. To summarise the proposals that came out of the briefing with the ICB, those were further scrutiny of the contract, which is included in the forward work programme and will be considered under item 10 today, and also to write to the Secretary of State for Health to seek confirmation that the Secretary of State is satisfied that all procurement guidelines had been complied with when commissioning for the provision of community health services in Wiltshire. So can I ask that the committee is happy to approve this proposal? Thank you. And any objections to that proposal? None? Okay, great. Now, I would add that we have received further communication. Sorry, David, is that a hand?
Yeah, I just wanted to make a comment on it, but you go first, and if I could just before we put our hands up.
Yeah, so just to add a bit further context, we have had, just before the meeting, a further communication from Unison. It's 4 pages long, so I'm not going to read it out, and it was only sent an hour or so ago. However, it essentially reiterates a lot of the points that were made at the last meeting. It then goes on to again request that we do formally request a call in from the Secretary of State. However, I think there is, I understand, a call in already issued from elsewhere, from a member of the public. I think with the letter that we've undertaken to write to the Secretary of State, having ourselves been assured by the ICB that it all was done in the correct way, I think I'm happy that we proceed on the basis that we'd previously agreed. David, do you want to add anything further?
Yeah, I mean, they've actually, in the body of the email, they've put a shorter statement in which they identify, they say that Baines, the health committee there, has called this in. So it's being called in. Yeah. So for us to do it as well would be performative, really, because it's now on the desk, as it were, of Wes Streeting. I do think it would be good if we could follow up with the Department of Health and ask if we could have a reply before the 1st of April, because it becomes redundant after that. And I do think it possibly was a miss not to have Unison at the February meeting. I think that was possibly our original plan. But we are where we are, and I'm happy that I don't think we should accelerate to a call in. I also think it's open to Unison to call it in.
Well, quite. It's open to anybody. So it's open to anybody.
I just wanted to put that gloss on it as I raised it earlier.
Yes, no, and I noted the line from Unison about not being included in the briefing. However, we felt that we'd heard from them at the previous meeting. We then wanted to hear from the ICB to satisfy ourselves, and so I think there was perhaps cross wires on that particular point. So we've approved that course of action. So I'm happy that that's all in hand, Julie. If we could get that letter sent, then that will be good. I'll move on to item number 3 then, declarations of interest. Are there any declarations of disclosable interests?
Claire.
So, Claire.
So, in the event that there is a response in the next few weeks, would it be helpful to circulate it to members, because we won't be meeting again for some time?
Oh, absolutely. I think any response received
Thank you.
will be circulated to members. Yes, item number 3, declarations of interest. I'm right, wearing the wrong eyes today. Are there any declarations of disclosable interests or dispensations granted by the Standards Committee? None? Okay, grand. Chairman's announcements. This is the last meeting of the committee of this council term, and the report on item 10 on the agenda is an opportunity to reflect on what the committee has achieved, as well as plan ahead for the activities of the committee that will follow this one in May. Very good. Well, indeed. No, and I was going to go on. This is also my last meeting as chair. I'm not seeking re-election in May, so I'll no longer be a member of this council. But I just wanted to thank you all for all your work over the years, over the last 4 years, and for all your input, and particularly thanks to Gordon for your wisdom and experience, which has been hugely helpful to me, and also to Julie for all of your support throughout the process, and Ben and Lisa and the team for all their support as well. And I wish all of you who are continuing the very best of luck continuing the great work of this committee for the next 4 years. Item number 5, public participation. Councillor Weigel, thank you for your question. You did submit a question to the committee relating to the recent budget proposals around adult social care, and these are published in the agenda supplement 1. We felt that as Councillor Jane Davies, the relevant cabinet member for adult social care, is not in attendance today, I suggest that we request a briefing from Councillor Davies to address these questions. David, would you be happy with that? That we arrange a briefing and then consider any further actions?
So a separate briefing, as we did with the community care contract,
Yeah.
separately, and before.
Before May, yeah,
Okay.
if possible. Are we allowed to do that? Yeah. Yes, apparently, as long as we don't make a decision, that's okay. So,
Yeah, I mean, obviously, I'm raising questions about savings that are, planned to take place from the 1st of April. And what I'm saying is, I don't think the councillors really understand what they are. So there is some urgency here in wanting to understand what they are. I mean, I want to say that, I'm perfectly prepared to hear that these are excellent changes taking place. It may be a massive expansion of the shared lives scheme, which we all know, saves money at the same time as enhancing people's lives. It may be that a lot of people have been identified as being able to live independently who are currently in residential care settings. Well, that's great. But I would have hoped we would have heard about that straightforwardly as a committee, and probably some in another way than at the small print of the budget papers. So that's why I have this concern. But if we could try and arrange that briefing as quickly as possible, like next week if possible, that would be great. And I think it's a good idea to do that. Thank you.
good. Okay, Julie, are you happy to go forward? Thank you. I guess as I proposed that we request that briefing, David, can I take it that you'd second that proposal and we can all agree that just to formalise things? Super, okay. In terms of the wider issue of select committee involvement in the budget process, members will be interested to know that Overview and Scrutiny Management Committee tomorrow, 13th of March, I think it's at 10:30, I believe, will be considering the arrangements for financial scrutiny going forward. The report notes that the current approach to Children's Environment and Health Select Committees engaging on the annual financial plan may benefit from review. Currently, the 3 select committees' only role with the Council's financial plan is to discuss it informally and submit questions, which are then put at an annual Overview and Scrutiny Management Committee. There is no separate opportunity for select committees to review the service outcome implications of budget issues within their remit throughout the financial year. So that topic is being discussed tomorrow at Overview and Scrutiny Management. Item number 6 on the agenda, Cabinet Member Update. This is the relatively new standing item that we have on the agenda, an opportunity for Cabinet members to provide a verbal update of activities in their respective areas. Since the last meeting of the committee that are not covered elsewhere on the agenda. We have had apologies, unfortunately, from Councillors Davies and Ian Blair-Pilling, so we don't have an update from them. Is Councillor Threlfall, did you have anything as the portfolio holder for adult social care transformation that you wanted to brief the committee on briefly?
I was just going to introduce the next item, the CQC report.
Okay. Item number 7 then, Care Quality Commission Inspection of Adult Social Care. This is on pages 67 to 74 of your your papers. Members, I'm sure will be aware by now that Wiltshire's Adult Social Care Services received a good rating from CQC. I'm sure everyone was delighted to see that, that rating being received. And this is the first opportunity the committee's had to review the findings in more detail. So in the agenda pack is a report outlining the findings of the inspection. This also contains a link to the full inspection report, which can be found on page 68, paragraph 12 of the papers. So in addition to Councillor Threlfall, I believe we have Mary Harvey and Kaylee Chapman providing a brief presentation on the findings of the inspection. So I'll hand over to you, and we've got Emma with us as well, of course. So I'll hand over to you for the presentation, and if you'd like to introduce, yeah, of course.
Oh, I've got it, but I've probably got a long in. Aha, thank you. Yes, Councillor Elizabeth Threlfall, as portfolio holder for adult social care transformation, standing in for Councillor Jane Davis, who is the Cabinet Member for Adult Social Care. And I have the, because Jane couldn't be here, I have the honour of presenting this detailed report from the CQC inspection. This was a very long and complicated process that was gone through, but it was published in January, and the rating for the council's adult social care provision was good. This rating was the result of a huge amount of preparation from the service, from practitioners, managers, partners and providers, who all worked very hard to ensure that CQC were able to see the quality of the service provided and the commitment of staff to deliver positive outcomes for residents and communities. And certainly I've seen that when I've been gone and worked with the teams on the front line, that their commitment and enthusiasm is absolutely astonishing. The adult social care team is very proud of the result, but equally committed to continuous improvement and to using the results of the survey to identify any areas that they're not already working on, to developing an improvement plan that will drive this activity over the coming period. And that's my bit. Thank you.
Hello everyone, thank you for inviting us today, and thank you Elizabeth for that introduction. My name's Mary Harvey and this is my colleague.
Hi everybody, my name's Kelly Chapman and I'm the Principal Social Worker for Adult Social Care.
Thank you, Kate. I should have added that I'm the Principal Occupational Therapist. I think I missed that. We're delighted, as has been mentioned, to share with you that our findings from the Care Quality Commission report that was published in January was that we were rated as a good local authority for the provision of adult social care. This is a fantastic achievement, and we just want to take this opportunity to thank everybody who's been involved in the process to date, including the people of Wiltshire with lived experience, their unpaid carers, the staff who've contributed significantly to this, our partners, and of course our leaders across the council for their contributions to the process and support along the way. Within this presentation, we're going to look at what the outcome of, we're going to look at the focus of the inspection, how the process occurred, and share with you some of the findings that were received.
Sorry, great, thank you, Mary. So as we've kind of discussed, this was a long process that we have undertook within adult social care. On the slide, you'll see a sort of a timeline journey of our preparation leading up to the inspection and then the publication of the report. The inspection of adult social care services came about within the Health and Care Act in 2022. So this was a relatively new process that we were looking at identifying our strengths, but also identifying those areas of improvement when looking at delivering our Care Act duties to the residents of Wiltshire. Through this timeline, you can see that we took this very seriously and we looked at working with partners, organisations such as the local government association to look at a peer review, which allowed us to have an external look on our adult social care services and really identify those key areas of strengths and where there were development leading up to the CQC inspection. Leading up to the CQC inspection and our notification, we completed a very comprehensive self-assessment of our adult social care services, where we were able to identify the way in which we support people with wheelchair unpaid carers and our partners to work collaboratively, but also identify where we are using our projects as a transformation to improve those outcomes for the people that we work with. Within that, we also provided quite a few additional documents to CQC, just highlighting the way in which we work within our adult social care services to ensure they had that breadth knowledge of how we deliver them. I won't kind of talk you through the whole timeline because I know that's within the report as well. But we also made sure that we focused on staff wellbeing throughout this journey and their readiness and preparation for us, the inspection. This was something that at times was a very new process to our staff group. So it was about leaning in and working with other directorates that we have across the council from their experience to really build up the confidence within our staff force leading up to inspection. The inspection itself lasted 3 days within September 2024, and that consisted of CQC meeting with some of our senior leaders, some of the leaders across adult social care, as well as myself and Mary individually. And as well as having focus groups with staff members and people that we work with across Wiltshire. After that report, we then were waiting for the initial outcome and publication, which happened in January of this year.
Thank you. So we're just going to share this slide, which gives an overview of the CQC themes and how they assessed adult social care across Wiltshire and across England. So there are 4 themes. The first is working with people. So they looked at how we assess people with the appearance of care and support needs to see how we were achieving that and how we support people to live healthier lives, to live their lives their way and in a way that's meaningful and supports healthy lifestyle. They looked at equity of experience and outcomes for people to ensure that we were treating people as individual whilst considering their what's important to them and what we could provide from a service in that respect. The second theme was providing support. This looked at care provision, integration and continuity, and also how we commission services and how we work alongside our partners and the community in which we serve. The third theme focused on how we as an authority deliver and ensure safety within the system. So how do we address risk issues and ensure that we've got safe systems to enable people to live their lives. And then it also focused on safeguarding that theme. And the last theme was regarding governance, how we manage our service and how we learn from improvement and innovate. Hayley.
Okay, thank you, Mary. So throughout the report, both the one that we've presented to yourselves today and the CQC report itself, there were some really positive highlights in terms of what they found within our adult social care services. One of the really key things to us that we are really proud of was the feedback that we did have from people who we work with, unpaid carers and partners in terms of the approach that our staff take, the fact that the staff are quoted to go above and beyond in supporting residents where needed through adult social care. Another thing which also came out of the report that we were very positive around was our prevention strategy being identified. And this wasn't just our prevention strategy in terms of us as adult social care, it was how that was supported across the One Council approach with support from the other directorates that we work with to really embed that early prevention aspect of engaging people within their local communities, supporting them to achieve the goals and outcomes that they have through that strengths-based approach in ultimately to prevent and reduce the delay of needs under the Care Act. Finally, the other one I will touch upon on this slide is that our transformation activity was really identified across the report, and how we are using that to improve people's choice and outcomes across adult social care, linking that back to the Wiltshire vision that we have developed, that we work towards, of the people that we support wanting to live their lives their way.
Thank you, Kaylee. Could I have the next slide, please? So we're really proud of all the positives that the report highlighted. However, with all things, there's the areas that we can work on next to continue our journey of development and improvement. And I'm going to pick out some of the key themes from this. Was one of the themes that they identified was the ability for us to enable people to have more choice about how they have their services provided if they have care and support needs. So one area we need to explore expanding further is direct payments and use of self-directed support to give people that additional choice. There was also scope identified in how we use technology-enabled care to work preventatively with people in the early stages and also reduce their ongoing need for care to enable to have that flexibility in how they have care delivered, not just in a traditional model. They gave us feedback regarding our accessibility of information, which we gratefully received. That we would love to expand the way in which we offer information to the people of Wiltshire, both online and in other formats, to ensure that they've got the right information to help them with their care and support needs and preventative needs early on, so that they can access all that information. They highlighted that we'd done great work on our waiting times, but we want to just go beyond that and identify that there's scope to maintain and improve those waiting times so that people get the best possible service at the earliest point for them. So they were the top development actions that were raised. There's more within the report and in the report itself, but we just want to conclude by saying how grateful we were for this positive result. It really reflected well the impact that our staff have day in, day out on the lives of people in Wiltshire who have care and support needs. And it also raised some areas for development which we are keen to adopt because we have an ever improving ethos. So thank you very much for listening. Do you have any questions? Hello.
Thank you very much. So, sorry, I'll go over to the committee for questions. Just to say thank you very much for the report and congratulations to all the staff in your team for that result. It's a super outcome, and it's good to see that those areas for improvement have been recognised, and I'm sure there will be action plans to deliver improvement in those areas. But overall, a superb result. So well done to you all.
Thank you.
Councillor Nick Dye.
Try not to. Thank you. Great report. One is the skills going above and beyond. Is that because going above and beyond sounds like a behaviour? When you say the skills are going above and beyond, is that CPD related or?
My understanding is that going above and beyond was how people in Wiltshire experienced that it was their experience of receiving social care. So when people went to meet them, they took things to the next level. They didn't just leave it with the bare minimum. They signposted people on for more information. They connected them with groups that were meaningful to them and took the time to really listen to people so that it wasn't a service level skimming, but it was going to the heart of the matter to enable people to get a really good outcome from that interaction, is my understanding.
But it does sound more like behaviour than a skill. I'm not criticising.
Potentially, yes.
The other one is,
we'll take that.
what's the average waiting time?
Across, do you want to say that?
So because we do lots of different things, it will vary depending on which specific type of assessment that you are waiting for. So for example, our occupational therapy assessments at the moment, you may be waiting slightly longer than if you're waiting for a care assessment. So in terms of that average, we'd have to get the information to you, but I think it's more kind of looking at the specific areas of focus rather than a sort of one figure. Yeah.
Thank you. Gordon.
Am I there? Yeah, I'm there. Well, an absolutely amazing result. Very well done. What really pleases me, Emma, is that all the way back to the peer review, I remember saying to you, if I was to ask any member of the team, would they say the same thing? And one thing that came out very loud and very clear is that this was a whole team effort, and it was a whole team result, and that people did say the same thing. And they said the same thing because everything was like second nature to them. That's really brilliant. I'm pleased to see the development plan, but can I urge you a second plan, really, to protect and maintain and enhance what we already do well. Let's not lose sight of those things by putting too much energy into developing the other things, you know, because they were the things that got that result in the first place. So let's not gain here but fall back here. So keep your eye on the game, really.
Yeah, no, thank you for your comments. I mean, I completely agree. And as much as we are hugely ambitious, that goes for the areas that we need to develop and improve, and also where we have been, you know, recognised for doing a good job. And there's always more to do. But our improvement plan will absolutely focus across so that we're not taking our eyes off areas that were identified as strengths. And thank you for your kind words around the staff, because they are our greatest asset. And I think that came through really clearly in the report, is what an asset they are to the council and to our communities as well.
Thank you, Gordon. Claire.
Thank you very much. Thank you for presenting this report. It's pleasing to see such positive findings, and again, I think all the staff should be congratulated for the part that they play in that. It's really good to see. Again, I'm interested in the side to improve. Why wouldn't I be? We always need to be heading in that direction. Again, I'm interested in the waiting times, because I'm very aware, with a background in health, that the waiting times is what is sort of clogging up the whole system. So obviously that's an area that is probably, I'm guessing, near the top of the list to work towards. Appreciating obviously capacity in our own teams is critical in that. And again, technology, that, you know, that's been sort of on the cards for some time. So I'm interpreting what you've played back to us as sort of be something that's played back to yourselves from CQC, of stuff that you were kind of already aware of. Is that reasonable?
Yeah, so yeah, so
Thank
we
you.
did a huge amount of work probably 12-18 months ago to bring the waiting times right down. So I think that's what CQC saw in the report, is the progress we had made. So they were much lower than they had been previously, and part of our ability to do that was how the teams worked flexibly across areas. So if we had one area where you were waiting longer than another, then staff were working beyond their kind of team boundaries to make sure that we were consistent, because you're only as good as your kind of most challenged area, really. We have to be consistent, and that's important. We absolutely are thinking about technology, what things like artificial intelligence and some of the tools on the market can support us with, to really streamline and make some of the processes quicker. And we're also thinking about how people can sort of complete self-assessments in advance, so that they've really got the time to prepare and consider what they want to tell us. So there's lots of tools that we can use to further improve within the existing capacity that we've got. But yes, it will be a continuing focus.
I just also wanted to mention that the waiting well policy, that people who are on a waiting list are kept in touch with somebody, and they're assessed constantly to make sure that everything is all right, it's not changing, they haven't become more urgent. So they are aware of the risks of waiting lists, but they are addressing that. And I think it got a good review in the report as well.
Thank you. Pip.
Thank you. Excellent report. Well done, Emma, and your team. Two things. One that I've mentioned before, this improving the use of technology is discriminatory to mostly the elderly and all those, and it's nearly 40% in Wiltshire who do not have computers and smartphones, and who would pay for it. So are you looking at that? I believe you are, but that's because I've had, because if you don't, that just increases loneliness and isolation, people just talking into a phone or a machine. So that's the only point I would make about that. And then from my own personal experience, the one area that does need concentrating on, and this is not new to Emma, is mental health. There, the delays and lack of accessibility is, from a personal point of view, not me, but my son, absolutely appalling. Partly his fault, but it's just not a good part of your service, which I'm sure you would admit to. So that's the only comment I would make about it. Other than that, I mean, it's perfectly fine report, but it does need a few tweaks, shall I say, in a few areas. But other than that, I think it's very good. Thank you very much.
Thank you. So I'll take the 2 points, if that's all right. So I think the tech issue, certainly we do not see it as the answer for everybody. For some people, it will be really helpful, but for other people, it won't be appropriate, and there can be lots of reasons for that. So we have to see it and assess it on an individual basis. So nobody is kind of proposing that this will be a one-size-fits-all and everybody will be offered the same solution. This will absolutely be part of an individual's support plan, and where it can add value, then it will be included, and where it won't, then then we need to absolutely take that into account. So there isn't going to be some kind of standard rollout that people have no option in. And in terms of mental health, I certainly, working with our health colleagues as well from that sort of crisis response, we are always looking at that, and we certainly want to focus as well on that early intervention and what the broader offer is for people who have a mental health illness and condition. So for fully recognise your points, Pip, and we'll certainly be including that in our improvement plan.
Thank you. Any further questions from the committee? No, none. Okay, well, thank you all for the report, and congratulations again to you and all the staff and the team, and wish you all the best in continuing that great work and on those areas for improvement as well, addressing those areas for improvement. So thank you. And I would move that we welcome and note the findings of the inspection. Could I have a seconder for that, please?
Yeah.
Thank you, Claire. Any objections? None. That's great. Okay, so thank you again, and we'll move on to item number 8 on the agenda. Wiltshire Council Business Plan, Adult Social Care Against Business Plan Targets, pages 75 to 86. There's clearly a strong overlap between this item and the previous one. Progress on the business plan objectives is reflected in the positive findings of the CQC inspectors. It's helpful for the committee to receive a performance report and consider whether there are subjects that could be picked up on the forward work plan. So I believe there's a short report which Emma Legg will present to us. So I'll hand over to you, Emma, and then we'll open up for questions from the committee.
Okay, just briefly introducing again the business plan and targets and outcomes. Adult social care service priorities focus on building communities and ensuring the safety and well-being of residents. This report is an update on the work completed in the different service areas within adult social care and housing that are aligned with the current business plan. It has provided the committee with a summary of the work undertaken and gives an overview of the breadth and complexity of adult social care. And it is indeed, I find it very complex and very broad, but fascinating. What I wanted to add to that was that everything which is done on an evidenced base, and the outcomes are constantly being assessed from both a financial point of view and from the satisfaction of a person who is involved in it. So it's all most impressive, the sort of assessments that are constantly going on. Thank you.
Could I just ask a question before you do the briefing? I was just struggling a bit to understand how you define adult care service plan and the 10, which has these 10 key activities, because clearly they are a subset of adult social care. It's not everything in there. Does that mean the other things are not relevant to our business plan? I was just struggling with what exactly it is. So I wonder if you could define it to start off with. Thank you.
Yeah, no, happy to, and fully appreciate the points you make. So this is really, so adult social care just is organised into its service areas, and fortunate to have 3 of our heads of service here today who are responsible for specific areas. So there is, this is only kind of a subset of some of the work that's going on. So we have a number of areas of work and improvement plans in place. We've touched on the CQC improvement plan. We have our transformation activity, but alongside that, the service plans will have things that they, alongside their business as usual and the work they're doing, they will focus down in on certain key priorities, and then those priorities can be reviewed and move on. So it's not all of the activity, it is some of the activity, or we would literally be here all week telling you kind of all of the things that we're doing. So this is a sort of high level summary that we've pulled out to give you a flavour, rather than this representing all of the work that we're doing, because really everything that we do links back to the business plan. So otherwise it'd be just too hard. So it's just some of the key areas that we've seen achievement and progress, and those priorities are reviewed all the time and will change. So that was really what I was going to say in my introduction, was to see this as a sort of high-level summary rather than representing the totality of the work that we're doing. And obviously these things change and develop as we go, as new priorities emerge. That might be due to legislation, due to partner priorities. They will emerge as we go. So if I have the first slide. So really, just to summarise, these were the 10 that the services have been working on, as we've said, alongside the other things they're focused around. You will obviously see in terms of the business plan objectives, we are largely working in that area around keeping people safe, as you would expect. That's one of our key statutory responsibilities, is around safeguarding. But beyond that, it's being safe and managing risk, are key elements of our business. Obviously, housing is fundamental as well, making sure that people are involved in decisions related to their life and how they want to receive their care and the outcomes they want to achieve. And obviously around our communities as well, and how our population live well together in our neighbourhoods and local areas. Next slide. So just picking out some of the themes, really, because obviously there is a lot of detail in the report and even more detail sitting behind it. So I didn't want to go through sort of every section, because I would assume that, you've had a chance to read it and digest some of this. But you will see there are some themes that are reflected through a number of the priorities. So obviously a key one for us is prevention. And I think that is really the golden thread that runs through the report and a lot of the work that we do in adult social care. We absolutely recognise that prevention is better than cure. And the other thing with prevention is that sometimes it's about maintaining where you are. If somebody has a long-term condition, we are not going to be able to prevent that deteriorating, because maybe there's a very strong medical reason for that, but we can certainly maintain independence and ensure that people are continuing to engage in activities that are important to them. And that's just as valid and as kind of, getting people back to levels of independence they may previously have had. We have our prevention and wellbeing strategy. We have our urgent care and telecare response, which is very much around keeping people at home when there's a crisis. And our rapid response service, which again supports carers when there may be a situation where their loved one may need to be admitted to hospital. Second one is choice and control. Again, we've referenced this in the CQC report, and this is very much how do we give individuals and their carers and their families the ability to shape how they receive their care and make sure it's really meaningful. A key focus for us now and going forwards will be transitions and how we support young people preparing for adulthood. and again, give those young people the opportunities around independence, employment that we would all want for our children and young people. And finally, how we work in partnership with a range of organisations across Wiltshire, be they statutory organisations such as the police or our health colleagues, and also our voluntary and community sector, much more broadly, be they larger organisations or smaller ones. So those are the kind of areas that you will see running through the report and running through the work that's underway. So in terms of the next steps, really, we will be prioritising feedback from people who use services and their carers to shape the priorities going forwards. We will be using our data. We are very evidence-led at the moment, as Elizabeth has said, but we will be further enhancing that and developing performance measures in terms of really being able to show the impact these priorities have had. And obviously, we'll be having a review of the service based on the CQC feedback and the improvement plan in that area as well. So I'm happy to take any questions. Obviously, there is a lot of detail in here, so I might have to refer back to the report.
Thank you, Emma. I'll open up to the committee for questions. We've got Claire, first of all.
Thank you very much for the report, Emma. There's obviously a lot of good activity going on here. Your next steps was actually what I was going to ask about, using the data and performance measures and indicators. I kind of wouldn't really know from reading this how well or not, how big the journey is, how much improvement is already happening, how much further the ambition would take us for it. And I'm just going to pick out one. You mentioned Home First. So how many clients went through that process as opposed to not? That would be really helpful to know. And then we would all be able to understand how that journey is improving over time. So I really look forward to seeing that element. And with my background, I'd be really happy to work with you to help with that. Thank you.
Thank you. Yes, and I know in the past we've brought some performance data to you, which again gives a sort of slightly different snapshot. So I think in terms of the forward plan, it's maybe aligning some of those priorities and then the key performance indicators next to them. Home First, we'd be very happy to bring back the detail. As you will know, Home First, from a Wiltshire Health and Care perspective, will be coming into the council from April, so there'll be the opportunity to think about that performance across that pathway in a different way, and we'd be very happy to bring an update.
Thank you. I'll head Gordon and then I'll come to you, David. You defer? Okay, David.
Okay. I may sneakily be trying to sort of smuggle in a question related to the item we didn't take earlier on here, but I'm just looking at this and I'm seeing there are obviously some things here which are expenditure items, like the new properties you mentioned, for example, at one point. And clearly, I guess there are some things here which will be savings if there are more people living independently. Is it possible to say what the net is on these items? You know, are we going in the direction of saving money because more people are living independently, generally speaking? Perhaps just leave it at that.
So I think giving a net position against these is fairly challenging. There's many complexities in the overall budget. I mean, we are certainly very confident that the moves we're making towards the use of sort of, you know, purchasing properties and allowing people to have their own tenancy and their own homes out of residential care will offer the local authority financial savings over an extended period. But that has to be then seen in that kind of broader preventative context, in that if we're doing something different at that transition point, for example, then that longer term need looks different. You know, the more people are in employment, the less they may need that different type of care and support. So moving parts are quite complex. So reaching a kind of single view about a net impact is quite challenging. But as some of these schemes become embedded, we'll be much better able to evidence the financial impact of those.
You happy with it? Yeah, great, thank you. Gordon, did you find your... Any other questions from committee members? No? Just looking through some of the things we sort of highlighted, wondered if it might be possible to receive a report on the impact of the prevention and wellbeing strategy, if we add that into our forward work programme. And just some patient discharge, obviously a lot of work is going on there. It's a key area of work, referenced on page 76. Of course, it always does remain a factor on impeding patient flow through the hospital. Is there further work to improve that? Are there areas that you're exploring to further improve things in that regard?
So I think the changes in Home First, we are fully expecting that we will see, increasing numbers of people going through that pathway, so they will go home. And that is certainly our ambition and the direction of travel more broadly, because it's obviously better outcomes for individuals, as well as obviously having a financial impact in terms of that reablement. The Wiltshire Support at Home scheme as well has certainly offered benefits, and we'll be looking at that. And what we need to do is when Home First comes in is think about the totality of the work that's happening in those discharge pathways, so that all of the different schemes are working together rather than maybe having some sort of unintended duplication. So we would certainly expect that to start to have an impact, but again, thinking into the rest of this year and next year, we'd be really happy to consider that, particularly with our ICB colleagues, as a lot of the work around this is joint.
Thank you. Yes, Diane.
Sorry, it's a bit late. It just made me think. I'm sticking to the same theme, and you've just mentioned about the ICB. I'm just wondering if these steps are also including caring steps together. I know I keep on about this, but trying to find out information is very difficult. Just wondered if you have any more information.
So we're obviously aware of caring steps together. I'm not sure I'm going to be able to give you a lot of detail regarding that today, but it certainly is something that we do want to promote further. We think it's a really strong scheme and can offer quite a lot. We just have to get it more embedded. But we're certainly happy to, if there's anything you wanted to email me in terms of specifics, and we can talk to our ICB colleagues about getting that information for you.
Great, thank you. Anything else from committee members? No, in which case we'll have a resolution that we receive an annual update on the business plan and add the report on the impact of the prevention and wellbeing strategy to the forward work programme. Could I have a second of that, please? Thank you, Gordon. Any objections? None. Thank you, Emma and Elizabeth, for the update. We move on then to item number 9, progress on the delivery of the Trowbridge Integrated Care Centre. You will find this on page 87 of the report, and we have, apologies. So you should have received the report introducing what's planned over the next 12 months in preparation for the centre opening. Gordon and I also had an informal briefing a few weeks back on progress on this. I'd like to hand over to Caroline Holmes, ICB's Interim Executive Director for Wiltshire, who will present an overview of the current situation with the development of the Integrated Care Centre at Trowbridge. So Caroline, I'll hand over to you and then we'll come back to committee for questions.
Thank you. Thought that was user error, but not, so that's reassuring. Thank you very much, everybody. Also just to say, just a note on the last item, I'll pick up with Emma outside the caring steps together, so we'll pick up a conversation about that separately. So thank you, everybody. I'm here with Jane Rowland, our Interim Director of Community Planned Care and Cancer, who's on the screen. Jane's going to take you through a presentation and an update on progress so far with the Trowbridge Integrated Care Centre. This is one of a really exciting opportunity for Trowbridge, and one that's really designed to help reduce some of the health inequalities in Trowbridge and to support the health needs of the local population. It's starting to take shape already. If you have a look at the site, you will see that the frame is already up. So we're excited about it going live from the beginning of January 2026. But I'll stop there and let Jane just take us through these slides, and then we're very happy to take any questions. Thank you.
Thanks, Caroline. Thank you, colleagues. So by way of summary, the Trowbridge Integrated Care Centre is a £16 million integrated care centre development that's there to replace what is quite an outdated community hospital in Trowbridge. And what we're expecting is that whilst many of the services based in the hospital will transfer to the new centre, the full list of what we're going to actually make available in it is currently still being finalised. I'll talk a little bit about that in a moment. I also want to acknowledge that £3 million of the project's overall budget has been put forward by Wiltshire Council through the Community Infrastructure Levy. And clearly that represents a great piece of shared investment in the infrastructure in Trowbridge to support healthcare facilities across the footprint. We are expecting the construction to be completed at the end of 2025 and will be opening to patients in 2026. And as Caroline's already said, you can see the frame's gone up. There are now reliably informed staircases, so people can now travel in theory between one level and the next, which is great news. So we are making really good progress with the site itself. We'll move on to the next slide. The thing about the new centre is it's absolutely about supporting the development of integrated models of care. So that's very much centred around doing more for patients in the community and as close as possible to their homes. And so this integrated care centre represents a really big step forward for us in delivering that ambition and that ethos across our BSW footprint. We also know 3 of Wiltshire's 10 most deprived wards are located in Trowbridge, and so we really believe that the development of the Integrated Care Centre affords us the opportunity to address local inequalities head on and to really think about how we can meet people where they are in their community rather than requiring them to reach facilities in Bath, Swindon or Salisbury, which are geographically some distance away. We also know as well that the population of Trowbridge will be increasing significantly over the coming years. And so again, it's important for us that the new centre makes it easier for more people to access health and care services, and in particularly those which fall under that umbrella of primary community care. So those things that people should expect to receive close to home in their community. Here's the next slide. I've said earlier on, and I hope you've seen through the slides, it's an ambitious project. This could be a hub for multiple health and care services, and we're already working with teams from different organisations to provide more seamless and joined up care. So really thinking about how do we bring together the best possible combination of health and care partners in the Trowbridge Integrated Care Centre to provide really great access to care and treatment for the Trowbridge population. Equally, we're going to be using the latest green technology. So for the eagle-eyed amongst you, you'll see on the artist's impressions, there will be solar panels, there will be heat pumps, and the building itself is intended to be fully self-sufficient and carbon net zero, which is a really important statement when we think about our public estate and how we're making the best use of that new technology available to us to reduce our carbon footprint and impact on the environment. I've talked earlier on about bringing care closer to patients' homes, people's homes, but also thinking about reducing travel times and relieving pressure on our other health and care services, such as our hospitals and our GP practices. We'll move to the next slide. We are aligning the Trowbridge Integrated Care Centre with 3 key shifts that we're expecting to see in the NHS 10-year plan. And we haven't had the full plan published as yet, but even in the interim operational planning guidance that the NHS has received just this year, there is a really strong focus on making better use of technology. So using digital technology to provide faster and more connected care. And that can be around things like booking appointments, but it can also be about the digital connectivity between our more specialist centres, so our hospitals, and our community assets like the Trowbridge Integrated Care Centre. I've talked about moving care closer to home. There is a strong focus within the operational planning guidance for this year on neighbourhood care and treatment and support, and really thinking about how we can use the Trowbridge Integrated Care Centre as an opportunity for us to really drive forward that ambition. And then the final point is about preventing sickness, not just treating it. So thinking about how can we use our facilities to think about what we can do in terms of healthy eating, in terms of exercise, bringing partners into the Trowbridge Integrated Care Centre and into the community to think about how we promote people to maintain their good health and well-being for a longer period of time. Move on to the next slide. Obviously, this is sitting alongside our new approach to integrated community-based care. So obviously we know across our footprint in Baines, Swindon and Wiltshire, our community-based care has been provided by different health and care organisations, and that has led to people receiving different standards of care based entirely on where they live. We are being deliberately forward-thinking, not only in terms of how we deliver our services in the future, but also thinking about how we tackle health inequalities. And as a result, we recently appointed a single provider, as many of you will know, HCRG Care Group, to take on our community portfolio. HCRG has ties to the local area. It was a key partner to the NHS during the rollout of the COVID vaccines, and it will have a presence in the new Trowbridge Integrated Care Centre. And there's a link within the slide pack for you to the integrated community-based care information on our ICB website. We move on to the next slide. We have a clear set of operational objectives for the Trowbridge Integrated Care Centre. Those are to provide sufficient physical capacity to deliver core primary care services for a projected population of around 62,000 in the Trowbridge PCN primary care network. And as I mentioned earlier on, we recognise that the Trowbridge population is set to increase in the coming years. The other part of it is about improving access to same-day urgent care for around 30,500 patients per annum, and that's through the development of additional capacity. Alongside that, we also want to provide capacity to enable the delivery of an integrated and increased range and volume of activity of community health, acute outreach, mental health and social care services within the locality and neighbourhood. And the key ambition around that is to reduce A&E and non-elective admissions, so to reduce the number of people that end up travelling to our acute hospital centres for care and treatment in an emergency. Obviously, we also want to make sure that through the development of a modern building that responds to local needs, that we consequently improve the quality and safety of our healthcare facilities for patients and staff across the Trowbridge locality and neighbourhood. And finally, we want to make sure we're making the most efficient use of the NHS estate in Trowbridge. So through the redesign of the building, making sure we're absolutely using the asset to the best possible, in the best possible way. Move on to the next slide, please. So the services that are being considered as part of our operational model, these are all services that have touch points into the existing Trowbridge estate. So examples include the minor injuries unit, radiology, and we've absolutely committed to having X-ray facilities within the Trowbridge Integrated Care Centre. But you'll also see there too our maternity services, where women come and receive treatment either antenatally or postnatally. You'll also see our community-based mental health services, so again providing opportunities for people to access those within the Trowbridge footprint, and thinking too about some of our physical health services like physiotherapy, some of our outpatient clinics that attend peripatetically, and also thinking about some of our community outpatient provision like continence services and diabetes. So a broad range of provision that we're considering as part of our operational model. Move on to the next slide, please. So in terms of the roadmap, and apologies, this is a bit of a click-through slide. As you can see, we're kind of going through a sort of stepped approach to the development of our operational model. So at the moment, we've been through a phase of establishing our working group. We've started some stakeholder engagement. So I've already been to the Trowbridge Area Board. We're going to be attending the Trowbridge Town Council to provide briefings on our ambitions and what we are intending to do in terms of the development within Trowbridge. We've then also started to work up a benefits realisation model. So thinking about how do we make sure that we really understand what the impact will be for our population of Trowbridge and how we can start to improve the health and care outcomes for them through the development of this facility. As we move through the next 6 to 9 months, we're also undertaking regular workshops. So we've carried out 2 already with partners who are involved in the development of the Trowbridge Integrated Care Centre. Alongside that, working as well through organisational one-to-ones, so having conversations directly with services that are part of our ambition for the facility. We anticipate that we will be finalising our timetabling and organising the move into the Trowbridge Integrated Care Centre in around December of this year, and that will conclude the first phase of mobilisation. What I want to assure members of the committee is that whilst this first phase is about moving the services we have into that centre, this is not a sort of one-off exercise. We will then be undertaking further phases of work to inform further transformation across the Trowbridge campus, mindful that with the redevelopment of facilities like the leisure centre within the Trowbridge footprint, there could be further options for us to integrate and develop more services in the community in partnership with colleagues across health and social care. Move on to the final slide, I think. So as we've alluded to, the core structure of the new building will be taking shape. So this hopefully is starting to give colleagues a bit of a glimpse of what the finished product will look like. We'll also want to undertake some work with the local community on the look and feel of the facility. And that's particularly important when we think about some of our groups and populations who may be affected by things like dementia, who may have neurodiverse needs, and thinking about how we make sure the facility is attuned to their specific needs so that they can absolutely find it as accessible and patient-friendly as possible. As I've alluded to earlier, we will be continuing to work with our partner organisations throughout the whole project, and we'll clearly want to continue to engage with members on our proposals for services and obviously seek your advice and steer on wider engagement planning. We're keen to make sure that we do get that feedback and insights as we develop not only our first phase clinical model, but also, again, just back to that phase 2, that second phase of work, as we evolve and develop what is available to our Trowbridge community from a health and care perspective. Thank you, colleagues.
Thank you very much for the report, and good to see that things are progressing with great pace. Members of the committee, any questions? I'll go to David first, as he's one of our Trowbridge members. So, David, I'll go to you first.
Thanks, Johnny, and thank you for that recognition. Thank you, Jane. I think you were kind enough to come to Trowbridge Area Board and explain this before, so sorry if I'm going to sound like a stuck record. But first of all, say it's great to see it coming on, and I think people are very excited about this in Trowbridge. I think they feel it's a real boost for the town. But of course, the big question is, are we going to keep the minor injuries unit? I think what I heard from you there was a commitment to having the radiology, which is great, but I think there's a nervousness about losing minor injuries. Only this week, on Saturday in a football game, I spoke to one person who works there and 2 people who've been treated there in the last week. It's, even though it is old, as you were saying, and it needs replacing, what goes on at that minor injuries unit is amazing. It acts to prevent people having to go to Bath. It gives them good treatment close to home, and not only caters for people from Trowbridge, it caters for people from Melksham and other places where there isn't such a facility. So it would be great if it was possible to say that it was going to stay. But I understand if there are still discussions ongoing. But generally, thanks for the presentation, and it's great to see it coming along.
Do you want me to?
Thank you, Councillor Viger. I wasn't sure, Caroline, if you wanted to respond first, and then I can add if you need me to.
Yeah, I suppose the most important thing to say is that there absolutely will be urgent care services located in the Trowbridge Integrated Care Centre. I think the exact makeup of those is being worked through at the moment, Jane, but it may well be enhanced from what it is now. I don't think there's any suggestion that it will be any less than it is now. Do you want to come in on that, Jane? Because there's lots of work happening on that at the moment, I think, isn't there?
Yes, absolutely. And Councillor Viger, just to reassure you, we in fact had a meeting yesterday to just talk about the urgent care side of what would be going through the integrated care centre. And what we can see is that there is a good degree of activity that's undertaken through the minor injuries unit. And clearly we want to maintain that and keep the footfall through there so that we make sure we don't have people unnecessarily arriving at acute hospitals, mindful of the pressure that they're under. So that's the work we were doing yesterday, and thinking about what might that mean, how would this new facility need to operate to make absolute best use of that, so people really do see it as somewhere that they can go and get that urgent response and that urgent treatment, rather than, again, taking themselves up to either Bath or over to Swindon, whichever they feel they would wish to attend. So I think, to be clear, we are absolutely working through urgent care services being available within that setting. What they look like exactly is still being worked up, but just to reassure you that that is absolutely a core feature of our planning and our development work.
Just to play that back to you, am I right in saying that what is there at the moment will stay in terms of a service, although it'll be in terms of minor injuries, the cuts, bumps and bruises, etc. But you might be adding to it other things that people need urgently rather than taking anything away.
Yeah, so I think what we're saying is minor injuries or minor injuries unit is a form of an emergency care on the day care, and that will definitely be in the new centre. The exact design of it, I think, is still being worked through, Jane, isn't it? So it might not be called a minor injuries unit, for example, but it will perform the functions of that, which is to deliver urgent and emergency care on the day.
Thank you. Can I just ask a follow on, because I represent Bradford on Avon ward, well, it's sort of a rural ward close to Bradford and Avon. We've used the minor injuries service in the past. It's been excellent. It does save that trip to Bath and the 8-hour wait, etc. that involves. In terms of catchment for that, would there be any change in that regard? Because clearly, as David alluded to, places like Bradford and Melksham don't have that kind of facility. So that wider catchment would still...
I believe so, Jane. I don't think there's any change to that planned at all. I mean, if there was anything like that, I think we would want to come back and talk to you about that. But I don't believe that's in any of the plans at the moment.
Great. Okay, thank you. Gordon.
Chair, you pinched my question, really. I was interested in that 62,000 population, and I wanted to know what comprises that 62,000 population, really, because there, as the chair said, there are many people in Bradford and Avon, and indeed in my community in Westbury, who use the facilities at Trowbridge both for minor injuries and post and antenatal services as well, and a plethora of other things. Are we sharing that facility with Trowbridge because we're in different PCN areas, or what do we do otherwise?
Do you want to come in on that, Jane?
Yes, so just to reassure colleagues, the facility, there is a primary care element of it, which is particularly related to the primary care network that sits around Trowbridge. But obviously, the facility is available and the services that we provide there are available for a much bigger catchment than purely just that primary care network. So you're absolutely right, Councillor. When we think about something like antenatal care, postnatal care, we would absolutely want that to be covering a broader area, mindful that there are people indeed who live in Bradford or in Melksham or in Westbury who may find it easier to access Trowbridge than having treatment up in the RUH or in Salisbury, depending on which way they've elected to go in terms of their treatment. So I think it's really, what we've said is we need the primary care element of it is for the Trowbridge primary care network, but the wider services that sit around that should be available to a broader population.
Yeah, Gordon, just with a follow-up. Yeah.
Yeah, and in terms of the clinics that might be run there for the other services, I'm taking on board urology, close to my heart, the urology, but that's provided at both Bath and Salisbury. And people, as you just rightly say, they elect to go either to Salisbury or to Bath. So will we be inviting both centres to run clinics within that centre?
We haven't yet fully determined, Councillor, exactly which hospital provision would be based within Trowbridge. We will have to go on the basis of what makes most sense in terms of the volume, really, because what we can't do is obviously you could invite lots and lots of hospitals to come to one centre, but there's a logic to that. How many people who choose Salisbury or who choose Bath would we be able to see within that facility? So that's all being worked through as part of the operational model. So what we're doing is taking quite an evidence-based approach to that. We're very looking at the numbers of people who attend, looking at the numbers of people and where they come from, so that we really build a service that is attuned to what the local population demonstrates it needs currently. So we're trying to work from that basis so that we ensure that we meet the needs of as many people as possible within the Trowbridge Integrated Care Centre.
Thank you. I've got a question from Pip.
Yes, I'd follow up everything Gordon has said. You've left out Warminster.
Not intentionally, Councillor. So again,
well, you
it
see,
is
this
available.
is the problem. Bath is 22 miles, Salisbury's 24 miles. And we're, as usual, stuck right on the fringes of anything. I mean, which is back to Gordon's question about 62,000. I mean, our population, if you took that off, would leave you with Trowbridge, nothing for Westbury, Bradford or Melksham. It must be nearer. So what are you actually planning for? 62,000 or 100,000?
So, Councillor, just to confirm, the 62,000 is the practice population for the GP services, but we're planning for a much broader footprint across the community, and we're taking a look at all of the people who use the services now, which would include people potentially from Warminster, and making sure that we are providing access for those people to services within the Trowbridge Integrated Care Centre. So what we're trying to do is to create something that meets the needs of people who use it now, but also take a broad view about how we could use it in the future. And I absolutely take your point. It is a long way from Warminster to Bath or to Salisbury, and Trowbridge is much closer. So therefore, we would want to make sure we were looking at all of the populations that wrap around Trowbridge to ensure that if there are opportunities where we can provide services closer to home for those populations, we're taking the opportunity to do that.
Thank you, Jane. Any further questions? Claire?
Thank you. Thanks for sharing all of that. It's an exciting project that's been some time in coming to fruition, I think, isn't it? It's a long time since I worked for Wiltshire Community Services that we started closing MIUs back in the distant past. So great to see this coming through. I've got two questions. Firstly, about the MIU and the fact that you've got radiology, and my fairly recent experience at Chippenham just underpins how essential it is to have the radiology available alongside the MIU, so people don't have to then go away and get an X-ray somewhere else, which can be extraordinarily inconvenient. And the second one, really building on what we've just heard, I guess, you know, let's see this one be a success, and hopefully the model spread to other towns. I look forward to this kind of thing coming together in Chippenham and potentially Warminster, Westbury, wherever else. I mean, we've got something quite exciting in Devizes as well. So it's really good to see these facilities close to home doing what we say, care close to home. Great to see it coming into practice. So thank you very much indeed.
Any further questions from the committee? No, I just had a question on the SIL. We had a discussion about this the other day in our sort of pre-meet. The 3 million from Wiltshire Council, does that come with any sort of accountability or any sort of caveat, or is it just here's the money, do with it what you will? I was just interested to understand.
I'd have to go away and give you a technical answer on
Right,
that, I think, but obviously it would be given on the grounds that it's used for the capital funds to build the Trowbridge Integrated Care Centre, which of course is what it's being used for.
Sure.
But I could give you probably a more technical answer if you needed one.
Okay, no, it's more out of interest, really. Thank you. No further questions from committee then? In which case, I propose that we note the progress being made in establishing the Integrated Care Centre and look to receive an update report in July, obviously to the next committee, as to how that's progressing. I don't know if the committee wants to suggest any recommendations about that, what report should cover, or if just a general update would be. Excellent. Okay, well, can I take that as a seconding? Super. Okay, any objections to that? Fine. Thank you both, Caroline and Jane, for the
Thank you
update.
very much, colleagues.
We look forward to hearing about progress.
Thank you. Bye-bye.
We move on then to item number 10, review of the work of the Health Select Committee 2021 to 2025. So as I mentioned earlier, this is our last meeting, the last meeting of the Health Select Committee of this council. The review that's in the papers summarises the work of the committee over the past 4 years and is an opportunity to reflect on how the committee has operated, its achievements, its challenges and recommendations for the work of the next committee. Thank you to those members who did respond to the survey requesting your input. Can I propose that we look at the sections of the report that need the committee's agreement? So in terms of how the committee has operated, this is captured under learning, page 102 of your report packs, paragraphs 7 to 12. Is there anything else that you would like me to take forward to Overview and Scrutiny Management Committee tomorrow? On that? I'll leave that one with you, and just other things to look at. Forward Work Programme Appendix 2. Does the committee agree with the following proposals? Page 111, to continue the work started on urgent care reporting. New agenda items in the Forward Work Plan, starting on page 112 of the report. Adult social care transformation. The committee has not recently scrutinised the impact of the transformation programme for social care. That's on page 112. Home First, impact of delivering services in-house, again on page 112. And then hospital transport on page 114, which was proposed by Councillor Pickernell. So I'd welcome any input. David.
So just on the HCRG issue.
CRG, yeah.
I think, I don't think we should let that sort of lie, really, in a way, in terms of process. Clearly, the ICB, possibly innocently, maybe, did not recognise that we are the vehicle of democratic scrutiny of the NHS in Wiltshire, and that therefore that is £10 billion contract over 7 years, should have been notified to us. Certainly, once it had been awarded, I mean, once confidentiality would permit, and simply saying please don't do it again, I don't think it's good enough. I think we need to. What I would suggest to open to scrutiny is that you get the authority of Wiltshire Council to ask the ICB to put it in their constitution that major changes affecting services in Wiltshire are notified to the Health Select Committees, the HOSCs, I think is the generic term, of Baines, Wiltshire and Swindon. Because no good having it in our terms of reference that we will look at any major change to health services if the people delivering the health services don't have it in their terms of reference to refer them to us. Yeah. So I think a request to the ICB to put that in their terms of reference would actually sort of act to operationalise the concern that we felt rather than just let it drift.
Yeah, and I think the really important thing with this, and I think this is probably something that's kind of been lost in the debate around this, is that that what's happening on the 1st of April isn't any change to services. So in terms of your average resident, there'll be no difference to service. But what I think is crucial is that if there is a reconfiguration of services, which my understanding is, and perhaps Caroline will correct me, is that whatever had happened with this contract is unrelated to reconfiguration. You know, if it had gone to a different organisation, there would still then be reconfiguration further down the line. So I think the really important thing in terms of our role and where residents are impacted is in any reconfiguration, and that we stress the importance to the ICB of engaging us ahead of any reconfiguration of services. Caroline, would you mind just coming to address that point? Because I think that's the crucial thing in all of this. Yeah.
With respect, I think the outsourcing of community care at the cost of 10 billion is a change. I don't think you can sort of talk away the fact it's not a change because it'll still be the same for the service user. It's a change in who provides it, and it's a change in the motivations of the person who provides it because they're a private sector organisation rather than, in many cases, I know there's some private sector organisations. So I think it is a change, and it's a change that we should be notified of. But that's not the point I'm asking. What I'm actually, the substantive point I'm asking is that you ask tomorrow if Wiltshire, as an authority, would ask the ICB to put in its terms of reference that any major change to health services in Wiltshire is notified to the 3 HOSCs, however they define it.
Yeah, I think we probably therefore need to be more specific, because the contract in itself doesn't change health services. So, no, not initially. So the contract in itself doesn't change services. This is and correct me if I'm wrong, but it's any reconfiguration that will be delivered by HCRG or whoever it would have been and it's essential that we are. I'm not disagreeing with you, but I wanted to be really specific because if we just say health services, any changes to health services, then any contract changes perhaps wouldn't be notified to us because they wouldn't fall within that definition necessarily, if that makes sense. So I'm not disagreeing. I'm just trying to make it more robust, if you like, and maybe making specific reference to contract changes rather than just changes to health services.
What I would do is not to try to address the specific HCRG issue with this. It's broader than that, because the ICB's response was we've dealt with it through our own governance process. And, you know, with all due respect, we are the democratic scrutiny of health services, and it should have come to us. But it's not just that one case. What I would do is I would go to our Health Select Committee terms of reference that we have for this committee, and there's some wording there about how this committee will examine any major change to health services in Wiltshire. And that same wording should be in the ICB's terms of reference.
Yep.
So it's there for them to define whether something's a major change or not, but at least it's in their terms of reference. So they're not simply saying, well, we deal with it through our own governance process and there is no need to refer it to the local authorities.
Yeah, and I'm not disagreeing with you. What I'm saying is adding to that, to perhaps add to that not only any changes to health services, because what the ICB could counter is that, well, there's no reconfiguration, it's just a contract. So perhaps we need to add wording that brings major contracts into that. Yeah. So I'm not disagreeing. I'm adding to. Caroline.
Oh, thank you. That was user error. So yes, I suppose just to we talked about these points last time, I think, as well, didn't we? In the January meeting, and I suppose what we were describing at the time is that, well, for a start, the contract is not an ICB only contract, it's a contract with Somerset, ICB and our 3 local authorities as well. We are the lead commissioner, though, for the contract, which is why the governance and the assurance around the contract award and the process that we followed and the guidance that we followed was assured through the ICB's governance processes, which is through our non-executive directors and our finance and investment committee, and then through the ICB board. So the decision was made there, and I think we talked through last time, it wasn't a decision for scrutiny committees to make. It's because it's not a service reconfiguration, and it didn't only affect one local authority area. It wasn't a decision for scrutiny committees to make. However, I think there are a couple of things to note. One is, in terms of service reconfiguration, I think, Councillor Kidney, you've made this point already. The change, a contract award does not mean, is not the same as service reconfiguration. There is no change on day one to services. There is a programme of planned transformation, but every step of that transformation will involve engagement as it goes ahead, and we've been very clear about that. I suppose the other point I think we did reflect on last time is during the actual procurement process, it was a confidential process because it was a competitive process that we were undergoing. However, there may have been opportunities for us to bring you more updates on the process that was being followed, and I think that is a reflection that we should take back and share back with our other overview and scrutiny committees. There were briefings, as I understand it, up towards the procurement until it went live, but then there was a gap in communications around that because of the confidentiality of the process. So I think reflecting back, that would be something I think I would want to take back to the ICB. But I suppose the other thing is just to be very clear, it's not just an ICB contract, it is a contract with our 3 local authorities and Somerset ICB. There is no service reconfiguration planned. Service reconfiguration in the main, we might interpret that to be reductions in services, so closures of services, changes in opening times, changes in geographical location. None of those are proposed for these services. They will be the same as they are on day one as they are on March the 31st. Thank you.
And just for reassurance, will this committee would want to be fully involved in any reconfiguration of services ahead of any reconfiguration?
Absolutely. If there were any proposed reconfiguration, we would follow our statutory duty and come and talk that through with HOS committee members.
And just coming back to David, the discussion David and I were having, is it reasonable for us to request going forward, or to get Wiltshire Council to request, that in future the ICB does notify us in advance of any big contract changes? Yes, we can't be involved in the procurement process because, as you say, it's sensitive, confidential, etc. But I think in future, perhaps a lot of the confusion might have been avoided in hindsight had this committee been briefed formally on forthcoming contract changes.
And I think that was the point I was making, which was, even though we couldn't have said, apologies, I interrupted, but even though we couldn't have said, because it was a live procurement, this is how it's developing, we could have said, these are the timescales, this is what's happening, this is what to expect. So I do take that point.
Sure. Okay, thank you. Pip?
Yeah, I think David's making a very valid point. Somewhere there should be a provision that scrutiny, whether it's financial, operational or anything, should always be advised that something like this, it doesn't need to come to committee, but we could have a person who would be responsible, either the chair or the vice chair, for some link. Because at the end of the day, scrutiny, whether it's us or all the other organisations, is very important. Not to be critical or have anything confidential, but all contracts and procurement should go at some stage through a scrutiny process. And I think David is quite right. is part of being included in the process. Thank you.
Thank you, Pip. David?
Yes. What it says in our terms of reference, and I just emailed this to you and Julie,
Yeah,
is that we as a Health Oversight Scrutiny Committee, a HOSC, should review and scrutinise any matter relating to the planning, provision and operation of health services in Wiltshire, including any significant change to service provision, those jointly commissioned or delivered by the council. So I think that does include a major change in provider. And that's our terms of reference. And I mean, actually with the best will in the world, we can't deliver that particular part of our terms of reference unless we are notified by the ICB. And I have said on previous occasions, it would have been my last meeting if we weren't having this special one, but I'll say it again, that I think it is odd that the Wiltshire Council Unitary Authority, whose job is to provide care, acts as the oversight for the NHS, and there isn't a separate oversight body for the NHS. In a perfect world, I think there would be an oversight body that stretches across health and social care and contains not only counsellors from the social care provider, but also some other members of the public who are stakeholders in the NHS. So it's not a perfect situation, and that's probably why we don't always get to know about things that are going on in the NHS, is because we're not the natural home for it. But I think if we were to ask the ICB, very, politely, if they would add that phrase to their terms of reference, that anything that falls under that category is referred to Baines, Swindon and Wiltshire Health Select Committees, then I think that would sort it.
Yeah, I mean, I'm very happy to suggest that tomorrow. The only point I was making was, could we make it even more robust by saying this includes contract changes that may not necessarily lead to service changes, if that makes sense. But we can have a think about how we add that wording in. Claire?
Thank you. I mean, the only point I wanted to make was we've actually heard about some planned service changes coming up in terms of the Trowbridge Centre coming on, which part of that will be delivered by HCRG. So that's great. We've heard that. So let's, celebrate that part of it is working. So just wanted to highlight that. Thank you.
And I think that is a good point, and perhaps something to think about going forward as well is linking any future reports we get, because we're all lay people at the end of the day, and so linking them back. So saying this is part of that contract that if there's any work stream in the future that perhaps is a result of, is part of that service change, linking it back to this contract so that we have that, we can place it within the broader context, if that makes sense. Thank you. Anything further from members? No? Well, David, I'm very happy to incorporate your suggestion, albeit possibly adding a word on so that we can capture contracts within it as well. Although also noting that the OSMC is looking at contracts anyway tomorrow and how we can scrutinise those going forward. Yeah. Grant, so where have we got to? Draft resolutions. Right, so any changes?
So looking through the report, seeing if people agree to the...
Okay, so if I take these in turn then. Okay, so the resolutions are as follows. So if we take these one by one. A, to improve Appendix 1 as a list of the HSC's or Health Select Committee's key activities and achievements. So could I have a second for that element, please? Thank you. Any objections? None? Is it okay to do it in this way, taking them one by one? B, to approve Appendix 2, to recommend to the Overview and Scrutiny Management Committee as topics requiring further work to the new council, including reasons, and that would include the item raised by Councillor Vigar today. So if I could have a seconder for that, please. Thank you. Any objections? Nope. Okay. And C, to approve the recommendations made to improve the working of the Select Committee regarding the following: prioritising discussion, scrutiny of service delivery, continued use of task groups and rapid scrutiny, maintaining a focus on key outcomes, to the use of briefings to keep members informed, and further involvement of people impacted by service. Seconder for that one, please. Thank you. Any objections? None. And then finally, D, to note the next steps in paragraph 13 of the report. If I could have a seconder for that one as well. Gordon, thank you. Any objections to that? Great. Okay, so that resolution / those resolutions, whichever it is, are all moved. Thank you. Number 12, urgent items. There are none, I believe, Ben? No. Any urgent items? Great. Date of next and future meeting. Oh, sorry? Yes, please.
Can't say much about this. Many people know that my day job is with NHS England, and some people may have heard in the media over the last couple of days that the NHS England, the centre, is being reduced by 50%. I learned today that includes Department of Health, so Social Care, as well as NHS England, and that extends into the regions. How that impacts on ICBs, it's completely unclear at the moment. But I thought colleagues might be interested too.
So sorry, there were 50% reduction in.
Yeah.
Where?
The centre, well,
So what's the centre?
the centre is NHS England and Department of Health and Social
Health and
Care.
Social Care. Right. Please, yes. Thank you.
So that is all I can really
Right. Okay.
say at the moment, but I just thought people would be interested to know that.
Yes, it's a very interesting time, I think, at the moment nationally for the NHS. So many of you will be aware that the NHS itself is in quite significant deficit, that it's got several very challenging, it's a very challenging financial position, and it's also very challenging trying to meet and recover from COVID, so waiting times, cancer delivery and so on, and A&E waiting times. So there have been some changes announced in the past few weeks. Amanda Pritchard, who's the Chief Executive of NHS England, is stepping down, and a number of the senior team at NHS England are stepping down. There is going to be a new Chief Executive for NHS England, but this is part of a change that will see much more direct control over the NHS, controls maybe the wrong word, influence perhaps over the NHS by the Department of Health and Social Care directly, and the Health Department directly. So it will mean that NHS England will play a much smaller role. The regional teams will change, and there will be much more direct management between the centre and our regional areas. At the moment, we are not expecting any, or there haven't been any announcements of any changes expected to ICBs. ICBs themselves underwent a 30% reduction in costs and budget about a year ago. So we're not expecting anything on top of that, but it changes every day, so we don't know. That's helpful.
Thank you,
I
Caroline.
think just in summary, it's fair to expect a level of disruption over the next period. They want to get on with it, but it's going to be quite disruptive. So just to be aware of it. Thank you.
Thank you for flagging that. So we'll move on then to item 13, date of next and future meetings. So the date of the next meeting is confirmed as Wednesday, the 5th of June, 2025 at 10:30 a.m. Sadly, I won't see you then, but best of luck to all of you who are here. Future meetings are noted as follows: the 9th of July 2025, 9th of September 2025, and the 12th of November 2025. So that brings the meeting to a close. Thank you all again for all your work over the last 4 years. And, oh, David.
I propose a round of applause for John, please.
Thank you. That's very kind. Thank you. Thank you, Gordon. Thank you all.